office-based surgical suite. We just finished performing a chilectomy procedure using our minimally invasive techniques. Hallux limitus, a condition that we've spoken about in the past before. Excuse me. Pull this down a little bit. Hallux limitus, a condition that we've spoken about before in the past. It's a type of arthritis of the great toe joint. It could be quite painful or actually very painful. So what we did today was we basically just, the chilectomy, also known as the remodeling and shaving of the entire joint, so to speak, to provide the patient some more range of motion. There's an accumulation of bone that develops on the top of the joint. So what we basically did was we shaved that down. It's a very conservative but yet effective procedure. And you know, when we put the puzzle together in respect to age, level of activity, just to name a few, those are the variables that dictate whether or not we pursue something as such. So I just wanted to give everyone, you know, a little sneak peek here. When we talk about one stitch, come around please, you know, let's get closer there. So, you know, that's where we perform. This is just one stitch. That's the incision. We'll put one little stitch. But, you know, now, you know, before the procedure, the patient was not, you know, able to do this. There was the joint was actually extremely stiff, number one. Number two, it was jamming. And the patient was having a hard time wearing, you know, even not really high heels, but even just, you know, small pumps. And what we basically did was, this is all anesthesia, if anyone is wondering, all this puffiness around here. But, you know, what we did was we remodeled all of the entire joint, a little bit here, a little bit here, a little bit here, to provide that, the patient that range of motion. So not only is there going to be pain relief, but, you know, she'll be definitely be able to use, you know, these pumps that she's been obviously wanting to wear pain-free. So, you know, again, we're here in our office-based surgical suite. The patient is wide awake. This has been performed under local anesthesia, about half an hour or so. But it's, like I said before, it's an extremely effective procedure. So we're going to go ahead and put one little stitch there, and that's pretty much it. You know, I can already feel, right? I can already feel that there is no bone. We have already remodeled everything, and as maybe you guys can tell or maybe not, but there's a little dell here, and that is that's where the bone used to be. Now it's obviously gone. It's been pulverized. So, you know, I know that everyone in the world of our YouTube channel has been asking me, you know, over and over, please show the procedures. You know, that really boils down to the patient, and, you know, some patients just like their privacy nonetheless. So I will continue to try to upload more and more videos, educating the world on minimally invasive foot and ankle surgery, and most importantly, that minimally invasive foot and ankle surgery does exist. As always, www.